So this is Nadia Atoba with Middleton Meyers. I am the digital content producer. Who am I speaking with?
Hi, so I'm Dr. Babafemi Onabanjo. Pleasure.
It's a pleasure meeting you. Can you explain what you do as your occupation?
Sure. So I'm a family medicine physician. I'm trained, but I also specialize in HIV primary care, as well as treatment of viral hepatitis, mainly B and C, as well as addiction medicine.
Can you break down how your job prepared you for the coronavirus before it started to spread widely?
So one thing I really appreciate about the job where I work at, which is a community health center, so we service the underserved here in the Worcester area, is that they're really trying to be proactive as the information was coming in. So they created incident command pretty quickly and really try to implement protocols into place to not only give us the equipment, meaning try to harvest as much PPE as possible, but also seeing how they can utilize staff effectively, efficiently, but also keeping in mind, okay, who are going to be the essential personnel who we need to bring here versus who do we not necessarily need, and try to minimize their exposure. So in regards to preparedness, they really just at least tried to develop infrastructure, a command center, so they can have at least some focal guidance to disseminate information, and then really just hosting multiple meetings on, if not a daily basis, every other day.
So what has it been like working with communities since the surge of the coronavirus has come into play then?
It's actually been very heartwarming. So there's a lot of organizations that have been really stepping up to the plate to help the multiple populations that we service. For instance, they opened up one of the local high schools in the area to actually shelter homeless populations from those who are infected by the coronavirus, but do not necessarily need hospital care, but they're still monitored by physician and medical personnel so they themselves remain safe, as well as decreasing the risk of them spreading their conditions to our other homeless population that still remains in the shelters. We've also worked with the community and thanks to the state, they're able to allow us to do telemedicine so we can still try to service our patients who have chronic care conditions such as uncontrolled hypertension or high blood pressure, uncontrolled diabetes. And really, we can actually service these patients through the comfort of them being at home, knowing that we're minimizing their risk because they are at-risk individuals who can suffer devastating symptoms from this disease, while still providing as much care as we can in the actual physical building itself. So I think our community has also done a great job in helping us back because we've had donations from patients who work with construction companies, giving masks, and really providing things like, hey, here's some coffee, here's like some free food here, thank you so much for what you're doing. And it's really been a mutual effort within the community. And I've just been, so appreciative of what they've been doing because, again, most of the patients we service are in the lower socioeconomic statuses, but yet they're still mindful and thoughtful enough to say, hey, these guys are helping us, let's see what we can do to try to help them.
Exactly, because you just stated homeless population, and we forget that even though that we may have places to go call home and go to every day, that there are those who don't. And how are the homeless actually, dealing with the situation, saying that we're all in a pandemic situation at the moment?
So they truly are a vulnerable population because you think about it, the goal is to flatten the curve as what's been perpetuated in the news to really try to decrease the number of people getting infected at a high rate. But in order to do that and do the social distancing, well, these individuals don't really have a place to social distance to.
Right.
Especially when we're thankfully coming out of the winter months, but you think about it, when they need to get warm, they have to congregate around each other, so they can't really afford to space out. And these shelters are limited. There really isn't a whole entire hotel room per se to service the entire population of homeless here in Worcester. Hence why they're coming out with these other programs to try to divide patients out so at least you can have the sick but stable individuals somewhere else for them to get better, while the other individuals who are safe and not sick that we know of can still be in the same areas having food and shelter in one place.
Right. So y'all actually go to patient homes and actually treat them from the house, those who are have diabetes and some of the other diseases you were talking about?
Oh no, so if I misspoke, forgive me. We're doing telemedicine. So basically from our office here, we have video conferences for some patients if they're able to set it up on their end, the video side. But majority of it are actually just doing telephone call or telephonic visits. We'll have nurses follow up with patients based on their blood pressures, their INRs, if they're on blood thinners. We'll call patients for any type of follow-ups. Again, for their diabetes, their high cholesterol, their asthma, and we'll even do some occasional sick visits if we feel like it's warranted. Mm-hmm. So again, says, hey, I have, these cold-like symptoms, I'm kind of worried. And we'll really triage them first over the phone to see are they candidates to necessarily come in, or are the candidates that would say, you know what, this is probably riskier for you to come here versus you staying home. Let's just try our best to manage it at home. But obviously, giving them the information if they feel like things are worsening and they're really unstable and don't feel safe, we encourage them to come in because we still want to see them, still want to treat them. We really are trying to reduce and minimize, again, the point of contact between person and person here.
That's smart. That's smart to be able to at least use the technology that we have to be able to kind of communicate what's happening and to be able to do a diagnose. I guess you'd be able to diagnose them through either a phone call they can be able to do or through what we're doing right now, web communication.
Right. And this really wasn't afforded to us in the, actually, 2-3 weeks ago. But because of how serious this pandemic is, a lot of states are giving funding to allow these services to actually be put forth. And our patients historically wouldn't been allowed to have these services provided for them. So my goal is, after all this, because I do believe we are definitely going to see the other side, is that they'll allow some of these services to stay into place, because I think we can continue to serve our patient at greater capacity than we were with the previous models we've been having.
That's pretty cool, and that's very smart. What are some of your procedures for when a patient is sick?
It really also depends on what type of sickness are we referring to. If we feel like they're sick from a potential COVID-like exposure and symptomatology, we'll have a triage process. So part of the triage process is, if you feel like you are well enough but just sick, well, we then just recommend the CDC recommendation about self-quarantine yourself, especially if you're not really having any other severe symptoms. So if you're having like a fever, we recommend Tylenol. If you're having a cough, we can send some cough medications to the pharmacies. And again, if things seem manageable, that's fine. Also, it depends on your risk of exposure to the people in that household. If we feel like, you know what, you're definitely sick enough to see if you might need a second eye to look at you to see if you're sick, we'll have a process here where they'll come to our walk-in center. And our walk-in center really does some great things. It should turn into a more testing center for any respiratory patient. So whether they may have COVID or the flu or COPD exacerbation, something respiratory concern where we really cannot rule out COVID, they'll go straight there and be evaluated and tested there. That's why testing supplies still last, because there's still a lack of that throughout the nation until they start sending out the supplies. But then if they're sick by other means, like, hey, I have just a headache, or hey, I just have, my stomach's aching or something, we'll do the triage process as well, ask them a couple screening questionnaires to see could they potentially still have COVID or not. And if they're not, they'll get transferred to our nursing line and to our provider here to do just a general sick visit. And again, we'll try to do our best to do everything on the phone, but if we feel like we really can't handle this or it's not appropriate to be seen and discussed over the phone, we'll then schedule them to come in for a visit. Due to, again, trying to minimize risk, we really have actually decreased seeing patients physically a lot, but that just means that we have a lot of same-day appointments people can drop by if appropriate. So it's a give and take with the current situation. And again, pretty much on a daily basis, we're revamping things here to see how we can best utilize and service the patients.
So what are some of the suggestions you can give to those who may have symptoms both mild and severe? Warmer weather brings mosquitoes, and so I'm pretty sure that some of us are questioning if we can be able to get COVID-19 through a mosquito bite. Have there been any reports that coronavirus can be transmitted through a bite?
So currently, I have not seen any studies about transmissibility with coronavirus through insect vectors. But my thought process would be less likely no, but still a possibility. So they've studied other viruses in the past and have shown that they were not able to be transmitted via mosquito vectors because just the load of virus entering the body was not enough from these little insect bites. Now, the possibility of a virus, if a mosquito bit someone, took enough blood from that person, and while it was still fresh enough and that same mosquito bit someone else soon after, then yes, there's a possibility, but right now I just haven't seen any data to support that.
Okay. Because I'm pretty sure, like I said, it's not just me and maybe others who may be thinking like, hey, so do I really not need to be outside during this time frame as well? Like if it's just your backyard? Due to the fact that it's been getting warmer and like myself, I've got some mosquito bites. So that is definitely a question of mine I had in mind as well. We also see cashiers wiping down grocery baskets in areas throughout the store when grocery shopping. It was stated that the virus can stay on contact for 3 hours. Outside of washing your normal fruits and veggies, do we need to start wiping down other products that we buy from the store? How about like the plastic grocery bags? Do you suggest us throwing those away?
So yeah, that's a good question, because you're right. Are we really going to adapt our whole entire way of life the way this virus currently presents itself? And there's probably more anecdotal information out there that I just haven't seen yet, but kind of things I've done in my personal house and what I've seen recommended by other people is that when you're in a grocery store, you really don't have an idea who all been touching everything left and right, and then how long have these boxes been on the surfaces and people come in and out. So it's really unclear to know the level of exposure that could be on these items. However, I think realistically, what you can do to be smart about it is that, yeah, all the plastic bags you get, I would recommend throwing those away, because even recommendations are telling you not to bring in your own bag, even though we do care about recycling. But your own bag might be having residue on it already, so we're trying to decrease these vectors. So put them in a grocery bag, throw those bags away when you get home, and try your best to put all your items in one area. After you put everything in one area, you can take the next step of washing your hands, and then any things that are in like boxes that are in other like plastic bags, you can just remove them all from the boxes and throw those boxes away. If you want to take it a step further, anything that's in a nice, comfortable plastic or paper bag, yeah, you can wipe them down with an antiseptic wipe. And I wouldn't do things like spray bleach on them, but more wipes will be better for you in these areas, because you don't want to contaminate any food within there that has a very small layer of protection. So I would say throw the grocery bags away, have an antiseptic wipe, and you can wipe down like the boxes around the things that are contained in it. But after you open them, all that should be fine. You shouldn't have to worry about that. And then just wash your hands afterwards.
Have you ever seen anything like this before?
I have never seen anything like this before. These are things I've seen within the history books, such as the spread of the Spanish flu, H1N1 during the epidemic, the pandemic of HIV. Again, all these have just been textbook, but nothing to this level of magnitude I've seen. And I think more recently was the SARS-CoV, or the ones that originally called SARS back in 2003, is the one that I actually recall living through. But again, not really being mindful during that time frame. But no, this is really unprecedented time. But the good thing about at least this historical references is that we've been able to create great things out of them. So I feel like this will be the same situation. It's just always scary living in that actual moment.
Yeah, because I don't think anybody ever even can imagine of us living through a pandemic, that we actually all are quarantined inside the house, and we can't wait until this is over and we'll be able to get back out in the public to be able to do the normal things that we used to do. Like, this new norm, I think, is getting to all of us. And I don't even want to call it a new normal. It's just like, well, it's temporary, and we will get back to our normal scheduled program at some point.
And even though we're all social distancing, it's definitely very important to not distance everything else. So definitely don't be emotionally distant from your friends and families. Try to find creative ways of interacting. If you're going to be at home, working or what have you, find different ways to make that time actually transition. So some people will have literally like their work clothes in the daytime, and they'll transition to their work clothes in the afternoon or the night clothes at nighttime, take a shower, go through a routine, just to make sure you're really not sitting at home every day, and every day feels like a weekend, because then it's like, oh, I have nothing to look forward to. You become a little more withdrawn, and that can lead to depression. I feel like during this time frame, we're going to start seeing and more developments of people with mental health disorders, just because this is a crisis, right? Mm-hmm. So people are going to find the symptoms, not only anxiety and depression through all this, but also PTSD. So there are things we can try to implement to create some sense of normalcy. So I've seen really fun groups join, like hangout groups on like Google, or they'll do like Facebook or live, or was it Instagram live, be DJs parties and stuff like that, playing games virtually, Zoom, and all these creative ways to really be interacting with each other. One of my friends had a wine down Wednesday via Zoom. So they're like all their friends on Zoom, and they had a wine, they just talked about their days and how things are going. And it was great. They were all laughing and enjoying things. So definitely try to keep those spirits up by other means. And you could try all the classic family games, as long as y'all don't be too competitive and try to kill each other afterwards.
I was trying to figure out how do you play spades through, I guess, a Zoom conference, but we haven't figured it out yet. Have not figured it out yet, but like, that's fine. We'll figure out other games to be able to play, or just do some social parties. Just can't be around each other. Just have to figure out other ways to be able to do it virtually now. What are you doing for yourself and family to prevent the coronavirus? And what are some encouragement and advice that you can give to us as we're all dealing with this crucial time?
So what I'm doing for my family is I am social distancing. So luckily my wife is not doing a full long distance like we did when we first started seeing each other, but she is staying Quincy, I'm in Worcester. And I am mindful of patients I've seen during the week. And if I felt like my risk of exposure is very minimal, I'll shower, do all I can, and I'll still go see them on the weekend. So I don't totally isolate myself.
Well, thank you again, Femi, for this.